Hello, this is Flourish, the wellness podcast for women of the Caribbean. I'm so happy to be with you again. I am Narissa Golden with my beautiful co-host Sonia Charles. Hey girl, how you doing?
Hello there, Larissa. Another week, another week.
I hope you're doing well. We're so close and yet so far, so we gotta fix that soon.
Yes.
Good. But what we are here for is to have another conversation with one of the people that we admire their work and who we've come across in our work with wellness and women. We are so happy to have Mr. Bamisile with us on the podcast today. Good day. How are you?
Thank you so much.
Now you are where we want to be in Montserrat. Tell us, how did you end up in Montserrat working? And tell us about your background, where you're from, and what work you're doing in Montserrat now.
Okay, thank you so much. Like you have rightly pronounced it well, my name is Adeboyega Bamisile. I got to Montserrat in 2019 March, so about 6 years, going to my seventh year now. I hold a master's degree in clinical psychology in 2002, and I've had about 17 years mental health practice as a clinical psychologist in a mental health hospital in Lagos, where I started working as a young clinical psychologist. And I rose to the position of the chief clinical psychologist before I joined Montserrat on the employee list of Ministry of Health and Social Services as the clinical psychologist under the technical core program. My role as a clinical psychologist has given me opportunity to do clinical, psychological, and psychometric assessments across age range from 18 to the last age in the aged 18 and above, so to say. I've also carried out psychological intervention with individuals, with family, with couples, and the groups of people across mental health issues across board. So far, I've had about 23 years cognitive practice experience as a clinical psychologist in mental health. Arriving Montserrat in 2019 has been a very good experience. I advocate mental health, I propagate mental health, and I also work with residents of Montserrat entirely under the Ministry of Health and Social Services as a clinical psychologist. Thank you.
Thank you so much for that. I've got a ton of questions. I think the first one I would ask is, when you arrived, what would you say as a nation was the state of mental health wellness in Montserrat?
Well, I won't go with either good or bad. What I know in almost every environment, mental health comes with a lot of stigma and discrimination. That construct was obviously noticed in Montserrat society, um, as well as other society, even in Africa, where I'm coming from. My country is Nigeria. Mental health comes with a lot of stigma and discrimination. But the first thing that I noticed was that with such level of stigmatization and discriminations, after a couple of years, people started to be open, and mental health is now, very well received in Montserrat environment. People can now turn in to discuss adjustment issue because the mindset of the resident entirely is that when we talk about mental health, we're talking about crazy people. That's the word they use, okay? And mental health is not just about psychopathology. Mental health starts from ensuring that your mental health is flourishing, is good on daily basis. And when it's beginning to go bad, early awareness of it, early intervention, early detection will lead to you adjusting and talking about how you can take it back to a good state. So generally, I would say that we have moved away from the position of being heavily stigmatized and discriminated against individuals living with mental health condition in Montserrat to a level where people are now open, people can discuss family issues, people can discuss work stress, people can discuss adjustment problems. And when you having issues like mild anxiety and depression, depending on what the challenges are based on stress. The stress can be biological stress, it can be socioeconomic stress, it can be psychological, it can be anything. So people are now coming in to discuss, booking appointment. And I believe that we have moved away from that deep level of stigma and discrimination to a level where people are now open, they're confident enough to come and discuss their issues with mental health professionals in Montserrat.
That's so wonderful to hear. I know Sonia is itching to jump in, but I just have one more question. I was just thinking about the time in which you came. Right after that was COVID. The reports have all said that there was an increase in mental health issues across the region, across the world. Did you see the same thing happening in Montserrat as well during that period of time and after?
Oh, yes. Of course, we know that Montserrat is part of the global community. I was opportune to arrive before the COVID, so I could see the trend of presentation. Now, during the COVID, of course, similar to what we saw across the globe, there were increase in presentations of mental health conditions. Okay, more individuals are having anxiety, more individuals are feeling sad based on the impacts of COVID. There are quite a lot of even what I would call normal anxiety, the fear of existence, the fear of freedom. You remember that we are all on lockdown. So many things change. Our routine, we have to begin to adjust to devise new routine in coping. A lot of people were locked indoor. Not going out to your daily routine can have psychological impact. So there were more presentations in terms of anxiety, sadness, and all that. And of course, a lot of people who have had mental health condition too, existing mental health condition, a couple of them also had relapses based on the circumstances, not necessarily because they are not on their treatment, but because of the impact of the development around the world and in Montserrat around that time. So individuals who have been diagnosed with, for instance, existing anxiety disorder during the COVID, we had more of those relapses coming up, and we have more people who have never been diagnosed with any mental health condition based on the changes in their structure, their difficulties in coping with the adjustment and all that. So we have a kind of all kinds of presentation at the casualty, but first we are on guard to be able to mitigate all that. And of course, to also assist the other residents who do not have any mental health condition, but based on the difficulties and the challenges that the COVID-19 has brought to us in Montserrat, we were able to at least go on live radio, do continue awareness program on the radio to see how both children, adults, and the aged can cope with the COVID-19, either in the ramifications of their mental health. So that we saw, definitely, we saw.
Thank you for that question. That was really a very good question. And it jumps right into one of the reasons why we have also asked you to join us on the Flourish podcast is to share some ideas about coping mechanisms, in particular with women's health screening initiatives. And we know that there are lots of screening initiatives on the island. One of them in particular is the breast cancer awareness program, where women can access mammograms to get their mammograms done regularly. There is also cervical cancer screening, and then lots of other screening programs. And the question is, what mechanisms are in place within the community to help these women deal with coping with these screening initiatives in terms of once they've had the test done, to be able to cope with getting the results or awaiting results?
Yeah, thank you so much. I'm particularly delighted that I'm invited to speak on your program about this construct. I recall in the last 2 years or so, I have been part of the programs on island on how to assist women generally during testing, any kinds of testing, particularly for medical testing. In Montserrat, of course, we have a well-flourished mental health unit now. And I know that I have joined you in the past to create awareness about people or women coming to seek psychological help or professional help when they are about to be referred for testing medically, during the testing, and even post-testing. Remember, we've also agreed that with your initiative, there are needs for women to be referred so that they can be supported, not only when they have tested and the result is out. There are quite a lot of things to be done pre-testing. Once the physician has raised the index of suspicion, the first thing before that individual is actually sent for testing is to be referred for psychological support. A mere pre-testing awareness and education about what the person is going for can do a lot of relief. So we have in the unit therapists and professionals who can support women to actually assist them to navigate through the period of testing to after the testing. And in case that the result or outcome of the test is also not pleasant or favorable, of course, we also need to continue with them to continue to discuss how they would be able to cope with the challenges of the outcome of their test results.
What would be your response to the reason why women become, we are focusing on women's health, so why would women become anxious or this increased anxiety pre-testing? What do you think are some of the reasons for this happening?
Thank you so much. I know the issue of anxiety is a general construct across male and female gender. While many people sometimes feel nervous, uncomfortable, okay, about testing, it doesn't usually cause serious problem or symptoms for some persons. But when we talk specifically about medical test anxiety, yes, it can be serious and it becomes a type of a phobia that women are always predisposed to. But to relate with your question, the question is, why are women more prone to anxiety during medical testing? Of course, it's due to a combination of factors, okay? Biological factors, social factors. But let me address the biological factors first. From studies or evidence, empirical studies have shown that women are twice likely as men to develop anxiety disorder in their lifetime. Why? Let's trace it biologically. Evidence-based research have also told us that women are found to be more sensitive to a low level of corticotropin. Cortisol, thereby, is an hormone that regulates stress in the body. But women are more sensitive to low level of corticotropin releasing factor, a hormone that organizes stress in their body. That may explain why women will be prone to anxiety in such situations. Another thing we need to note from the biological factor is that across the life cycle, whether at puberty, during childbearing, or at menopause, women have fluctuations in the hormones in their body. And some of these fluctuations can also predict anxiety. But looking at social factor, we know that women develop a coping method or a cognitive style that is predominantly prone to ruminations and worries compared to men. That is the social factor. So in doing so, women are more likely to beginning to witness stress when they have issues to be tested for a certain medical condition. And of course, some of the women who are still experiencing anxiety might also be experiencing doing so due to the past screening experiences. Some of these women would have had testing, screening in the past, whether for cancer, for mammogram, or whatever. Now, the experience they brought out of that past screening may not be so pleasant, especially when we consider the issue of pain during testing, the time they have to wait, the way and manner the testing was done. It may not be a pleasant experience to them. So past screening experience explains why women are likely to witness anxiety as well. So it's not just due to one factor, it's combinations of factors.
Yeah, I was thinking that, like you talked about the social side, women are most likely to be the planners, especially if they've got children and they're already thinking about what happens if the test is negative, if it's a positive test, the implications of that. And especially if they've got concerns, how much our families have changed. So you don't have this extended family anymore. And lots of times these women are the sole providers, caregivers, and I can imagine it just being a super anxious time trying to figure out what do I do if this thing becomes, and it's really hard to calm yourself. Do you allow women to have, whether it's a friend or their partner, to be part of the therapy if you're doing that as well? Because I think that having that other person to support them is important.
Sure. Sometimes in the therapy session, there might be need for what we call social support. So having partners sitting with them in the therapy session might be useful. Having family members who are played very significant role in supporting them in their lifetime can also be very useful. So we encourage people who are significant others who can give social support that would have been identified during the initial interaction to actually sit down with them and support them during the sessions. And like you rightly said, sometimes some of the women can also look at the social implication of going through testing, and the testing becomes either positive or negative, depending on the construct. Some results will come negative and it's not favorable. Some results will come positive and it's still not favorable, depending on the construct they are looking at. But beyond, the family dynamics is showing that if such women are the sole provider or the breadwinner, the implication would not only stop at the box of the table of the woman or the women, the family members would also bear the brunt accordingly. And sometimes you have men and other members who are breadwinners, but the fact remains that whether breadwinner or no breadwinner, nobody wants to lose any family members at an untimely age. So the fear of death, it can create more anxiety. The fear of losing it can create more anxiety. The fear of, oh, if it's detected, how is it going to be managed? And again, I always believe that breaking the news can also reduce anxiety. The way and manner the news is breaking. In our environment, we are still struggling to actually do a lot of confidentiality in terms of our health system. Okay, even though we have moved away from where we were a couple of years to a very advanced stage now, where we use the health information system. But you can imagine if you go for a test, while you are still going through the anxiety and all that, the result is coming from an unapproved sector. I mean, of course, the person who has the sole right is the physician who have ordered for the test to interpret the test. But when you begin to have information filtering out from unapproved quarters, they may not even tell you the exact thing that is in the text. Rumor can go around that, oh, this person is going to die in another 10 days or 5 days because the test result shows he's positive for this or she's positive for that. Okay, so those are some of the things that go through the mind of women when they are waiting to get the test result, and they all create anxiety across board.
Do you find that faith or spirituality plays a role in how some women are able to explain how they're able to cope during times like this, anxiety, dealing with results, things like that?
You're talking about faith-based belief, faith? Oh, yes. Quite a lot of support have actually come from the belief system. When we talk about the faith base, the support of the churches and whatever you believe in that is supreme, obviously go a long way. I have managed individuals, even in this environment, where the church members have provided quite a lot of quality support. They believe in, even though in miracle and in healing, and they pray for healing and miracle. It may not happen eventually, but it goes a long way in supporting that mind to be hopeful based on her faith. Okay, so at least there will be a moment of respite. Eventually, the eventuality might come, but before the eventuality comes, the belief system hanging on the faith and the support of the church or the faith-based group can actually mean well along the line. So I've always put that as part of the intervention. Of course, when we do intervention, we say psychosocial and spiritual. So the spiritual angle of it is actually taking care of the faith base from whatever that individual believes in.
That sounds good. Just sort of following up on Nerissa's question, you've explored the opportunities that exist for professional help. We just talked about spirituality, that if you have a faith-based community and that person is connected to that community, you have that element of support. What would you suggest are other mechanisms that can be useful to women who are getting ready to have diagnostic screening tests done for, in particular, mammogram, cervical cancer screening, and other screening programs? Are there any other mechanisms that can be offered to these women for control of anxiety?
Yeah, I think I would like to address it in form of a protocol. Usually, I personally will always prescribe that when a physician or anybody is referring any woman for a medical test, whether mammogram, whether pap or whatever, it should be in a protocol way. First of all, there is need for pre-testing. There's an advantage in allowing such women to undergo pre-testing counseling. And during the pre-testing counseling, they discuss why she's referred. What are the expectations? What is likely to come out? If A happens, how is it going to present? What is likely to be done? If B happens during the testing, what is going to happen? How is it going to present? Are you getting me? So you are preparing the mind of such woman to be whole and bold enough to go into that testing. Okay, so understanding why you are referred, understanding your issue, what necessitated that referral in the first instance will go a long way in bringing some moment of respite. That could be done during pre-testing. So giving all the psycho-education surrounding the reasons why the physician is referring you for testing, what are the expectations, if it happens. For example, those days, what we used to do during the HIV testing, there's a pre-testing. So if it is positive, these are the expectations, these are what you should do. It's not a death sentence per se, if it's well managed. So that will be done during pre-testing. While the woman is waiting to be tested, there's also some kinds of need of support that person needs. You may not have the therapist readily besides you, but if you have gone for the pre-testing, the therapist would have been able to give certain information to you to be able to, that will be useful to you while waiting to be tested. Okay, so things like deep breathing is very important, especially you take slow breath, 3 times, take it slowly, count 3 to 5 repeatedly, do some sort of things that will make you to distract your mind from the negative thoughts you are having. That will help. Counting can also help. Sometimes you need to do some imagination. Okay, you close your eyes, picture an image or place that makes you happy. That can make you to cope with the challenges, with the anxiety of waiting to be tested. Muscle relaxation is another thing that person can do. So you may not have the therapists around you. You can have people within the testing room that you can interact with. So we call it diversionary talk. You can begin to talk with them. They talk with you, and by and large, if you imagine when the doctors are carrying out surgery, pre-surgery, while they are arranging the theater and all that, the person is going to the theater. They engage in conversation, general conversation socially. This is used to actually get the mind of that person away from anxiety. So those things will help while you are waiting to be tested. Now, another thing is that while the test result is out, because there are 3 levels: pre-testing, while waiting to be tested, after you have been tested, the test result is supposed to be out. So I have mentioned the issue of breaking the news of the test to you. How the news is broken is a factor that can either predict more anxiety or relieve anxiety. And we've always said that breaking news, whether bad or good, should be done in a very protocol way. Okay? The news, we are going to make sure it's not coming through the back door from unauthorized source. The authorized source will sit down, make sure there's an appropriate setting, whether the news should be broken with within the family members to the person, or with the person and her spouse, or with the person and her children and other family members. All those needs to be determined. The mental state of the woman as at the time the test result comes out, whether there have been significant events between the last time she went for testing and before the test result comes out. So there are so many factors to be put into consideration before the news is broken. Then when the news is broken, whether positive or negative, whether pleasant or pleasant, if most times it is unpleasant, then the person should have the comfort of the therapist to continue management. So we've always talked about having this protocol in place. Pre-testing, awareness, and counseling is important. While waiting to be tested, there are a array of things that individual can do. When the test result is out, the person is not left alone, breaking the news, and of course, putting that person in the comfort of the therapist. So these are some of the things that are available to be done for any woman who is seeking to be tested for one form of medical condition or the other.
I can see as a follow-up that this would be a very important step towards compliance, because one of the issues that we face in the Caribbean, and in particular in the Caribbean, is compliance, whether it's male or female, to accessing and utilizing the services available for testing. And compliance is, again, a problem because of fear. So you probably could have 100% compliance, but you're having 65 because the remainder of the women are fearful of attending, subscribing, or even speaking about testing. So I think the mechanism that you described, they are known and available. It will help with the increased compliance to testing before the disease is spread throughout the body.
Yeah, I agree with you. In terms of compliance, it also starts to emanate from the issue of conviction that, well, if this condition is detected, it means that I have to start intervention as early as possible. So depending on how the information is put out to the person before the testing actually come up, pre-testing, that can also be linked to what level of compliance the individual is going to see. But for us in mental health in Montserrat, we've always encouraged physicians, medical practitioners to have as an adjunct to intervention, the protecting the mental health and doing some counseling for everybody that is referred on the island. So that again can show up the issue of compliance. But the way I want to see compliance, it starts from the initial protocol. Once the individual is convinced of the fact that I'm going to introduce testing with the purpose of getting something detected and continue intervention as early as possible, it doesn't necessarily mean it's a death sentence. It doesn't necessarily mean my life is going to come to an halt, but it is good that I detect it early so that my physician or my doctors can continue intervention as early as possible too. I mean, quite a lot of cases that were detected early enough, early detection, early intervention. So many people have survived those critical conditions. A lot of people have survived. So if during the pre-testing, such information is put out to such woman or women, group of women, definitely they will be encouraged to go beyond testing to also complying with intervention procedure.
I think that's really important. Can't remember seeing any material that encourages women to seek out specific mental health support, as it relates to when they're going through testing or any sort of thing like that. So it's good to know that it's available, and we definitely need to do more work to educate women about what's possible. Because as you were saying, Sonia, if I am just fearful of the process, I may just decide I'm not even going to take the test,
That's right.
So I never even show up to the clinic or the doctor for them to say, well, guess what? We do have people who can support you and would love to talk to you before you do it, after you get, to help you when you get the diagnosis, things like that. Because it can be a very lonely process. And so it's good to know that it's there. And we definitely want to do more to promote and educate not just women, but the community as a whole, that they can seek this sort of support to give them that assistance that they need. I remember a few years ago, it was a young man actually, and I know we focus on women here, but I was very impressed when he told me that he had actually sought out your office for help. He was going through a tough time. And he said, he was hesitant for a bit, but then he did show up and was able to go sit down and talk. So I think that's something that's good. Again, you're talking about seeing this change in people now being more open to talk about their mental health issues, because it's still in many circles seen as a failure that you don't have the capacity to manage your own, your own issues, your own stresses and things like that. So thank you so much for your consistency, Dr. Bamisile. I think part of it too is it's the length of time you've been there as well. So you can become part of the community. I think often when we've had psychologists come through in the past, they're there for a year or two. So it takes time for a community to trust you, especially when it becomes something so personal as what's happening in their life, their relationships, in their mind, and things like that. So I commend you for still being there and really supporting our people. And I
Thank
called
you
you
so
doctor
much.
again. I'm sorry, Mr.
Thank you so much. Just to add a few things, you correct about the length of time. And I think mental health is not something when you look at the sports arena, the length of time the groups of players are put together, the coaching crew, and how they blend together to begin to play or do something that will be more effective and win laurels. It's not something that will start the first day. It's a progressive thing. So I like the fact that you acknowledge that length of time. And that's one of the things that I think has been very positive in Montserrat environment. Like you said, people spent 1-2 years ago, but now in terms of relating with members of the community, two, getting familiar to them, understanding their issues, the therapists do not just have to do that within 1 or 2 years. So beyond 3, 4, 5, 6 years is always a positive thing that will add more value. I think I must also commend our doctors on island now, both private and government employee doctors. I think I used to say a word. They are now more psychologically minded. Nothing will be done without doing a referral to the mental health. I mean, just to digress a little, common, I mean, not common, amputations, loss of miscarriages, so many things. So doctors are now psychologically minded that they do refer to the mental health unit. So one of the things we have advocated is that please do not go ahead with critical testing without employing or recruiting this person to start from the beginning, pre-testing counseling. Some of them can do it because what you need to do is to provide a lot of information that will be relevant to that individual referring to the testing. But in case of you who are not able to do it, pre-testing counseling, while waiting, that individual will have things that will enrich her to be able to cope with the anxiety while waiting. After the test is out, of course, it's a protocol. You have to invite the therapist to be seated and to look at the best way of delivering the news, whether good or bad, to that individual. And, therapy will continue from there. So thank you for acknowledging that. Time is of very important factor.
What we've heard in the last few minutes is that, as Nerissa pointed out, is to get the involvement of the clinical psychologist in the process from the referral stage all the way to the treatment or intervention stage of that patient's journey, so that the clinical psychologist is involved from the very start. And I think that is something that the public should be aware of. And I think many people are aware that this service is there, but again, how do they access this service? And can they just walk in? How do they speak to a professional to say, well, or would they be told that this service is there before they approach the first phase of testing, which is the referral stage? And one of the things that we've seen on Montserrat in the last few years is our program where women attend for breast health check. And it's at that breast health check that they get an opportunity to speak to the doctor prior to having the mammogram done, and not just signing up and going off for a mammogram. They get to speak to the doctor, to talk about their breast, to talk about how they feel. And that part of it should move on to where the clinical psychologist can actually help that person in their journey towards better compliance with attending for a mammogram or any screening program. So I think that we're seeing a really good intervention on Montserrat over the last few decades, more than likely, where this intervention has really helped women to be able to get the help that they really need.
Yeah, just to add to that, our pathway for referral is very simple because we are mindful of the fact that quite a lot of persons will want some sort of confidentiality in referring them to the clinical psychologist or the therapist in the office. Individual can walk in on their own. Individuals could be referred by the physician, or individuals who have been referred, and in case the physician forgets to refer for pre-testing, can also walk into the office and book an appointment to speak to the clinical psychologist or the counselor in the office. So I am going for a test on so day. I feel I should come and speak with you. Then the interaction starts from there. So we've always encouraged a very flexible pathway to referral. Yeah. Anybody can come up and discuss. The physician can also refer, or whatever test the person is going to, but the referring body is encouraged to refer prior to the testing so that we can put in the protocol or implement the protocol as it is pre-testing education, during testing, and post-testing when the test result is out.
That's brilliant. It's so good to hear that. And I'm glad there's that flexibility because sometimes you don't exactly know you need it until you need it. So it's good to know
Yeah.
that people can walk in and ask for that support. Before we wrap up here, because we've gone through this time so quickly, could you give us some tips, just some everyday tips on how we can manage our mental health? What are things that we should be looking for that says we are in a good place, with our mental health? And what are other things that we should probably seek help for before it's too late?
In terms of mental health, I mean, the first line is for individuals to keep acknowledging these are emotions. We all have emotion. God has, wired us in such a way that any life event, whether positive or negative, predicts certain emotions from us. So it's important to start to acknowledge your emotion, okay? Then there's something we call self-care. We should all practice self-care. These are ways you can begin to protect your mental health. Some individuals don't practice self-help. They're at work, they don't pay attention to themselves, they don't relax, they don't take a break, they don't go on vacation, they don't go, these are some of the things that are very important. Exercises, practicing relaxation, mindfulness, okay? And sometimes it's not always being burdened in your mind. The stress of the family, the stress of work, the social stress, even the stress in the churches too. You are the leader of this group in the church. You have so much to combat with. You have programs to organize, and we all strive for success. So this thing can have a toll on our emotions and our mental health. So apart from practicing self-care, you can seek distractions. Take yourself out, go to the cinema, go to the beach. In the Caribbean here, the beach is almost everywhere. You take during the break, drive yourself out of work in your break time after eating your lunch. Go and just sit down in front of the sea, relax your mind, okay? And when you think that you are not getting it right or you are getting overwhelmed after you have tried all sort of things, please always seek support. Always seek support. Seeking support does not mean you are less or you are not up to who you are. Seeking support is probably something that is smart to be done to add to the value of your skill. You have tried all sorts. You exercise, you do mindfulness, you do body distractions, you do all kind of things. But then there's this particular life event that is seeming to be too overwhelming. Please ask for support. So these are some of the ways we can care for our mental health condition.
Thank you so much for that. We just need to remember we were not meant to live this life alone. So good to know that the mental health team there is, they're bolstering and has more capacity. So it's good to hear that there are other people there that are supporting you as well. That's wonderful. Thank you so much for joining us today. We are going to share all of the details about the mental health office and how people can connect with the unit and with your team. And we appreciate all of the advice that you have shared with us. Thank you so much. Sonia, be sure to practice some self-care this week.
I will.
Take care of yourself because I know you're working hard. I will do my best to do the same because I'm one of those people that will eat lunch and be on the computer and everything at the same time. Every now and again, you got to remind yourself to just step away and breathe and go and do something else. So we do that and we encourage you to take care of yourself and find ways for you to flourish in your own life. See you next time.
Thank you so much.
Thank you.
You've been listening to Flourish, the wellness podcast for Caribbean women, produced by Rebel Rock Media Limited, music by Peter Spacey. Discover more at wearerebelrock.com.